Welcome to this most recent episode of the Econ Report. Today, we're super happy to have Kelly from Georgia, as she's known on Twitter. She has been routinely making fools of all the public health and data experts out there since, I don't know, since very, very, very early on in the pandemic. I think I started following her more than a year ago. Because if you want to figure out what's happening with COVID, especially when it comes to kids and what the actual data shows, you check Kelly's account. You don't check the CDC's account. I don't know how we got to this place, but that's where we are. So Kelly, welcome.
Thank you. Thank you for having me.
Yeah, I know, it's great to have you. Thanks for taking the time. I know you're super busy. So Kelly, who are you? Are you currently in Russia? Are you in Moscow?
Yes, I'm a Russia bot. And I'm a mom in Georgia, and
Georgia, the United States, not Georgia.
Yes, Georgia, the United States, Atlanta area.
Have to be sure.
Yes, I'm just in suburban Atlanta, and early on in COVID, I didn't know what to make of it, and I tend to get kind of panicky about medical things sometimes. So to me, like the way I handled that was like, well, let me look at the numbers because I'm a math person. So I just started kind of tracking, and I started specifically with Georgia because I'm here in Georgia, tracking the numbers. And that helped me like kind of see things to where it wasn't just the panicky headlines. I could actually see the numbers, see the trends going up and down. And then, it kind of developed over, like that was early on in 2020.
Right.
And so then over that summer, when it started becoming like, oh, are kids going to go back to school or not? And I was like, well, we definitely are. I was like, I hope other people are going back to school. I kind of pivoted. I was still reporting on the Georgia data, but kind of started this more of a focus on the kids stuff of just like, why are we freaking out about kids? I was like, I'm certainly planning to send my daughter back in August. And she did. She went back full time in person, like the first week of August of 2020.
So when was it? When was it that you? Obviously, March of 2020. I guess yeah, right? February, March of 2020 is when kind of the crap hit the fan in the U.S. and New York City, and everyone started shutting down. But so when was it that you first were like?
Yeah, I'm not a news person normally, and I wasn't on Twitter. I had an account, but I wasn't really a Twitter user. And I basically didn't know it too much about COVID until, late February, early March. I had a conference, like a big international conference that actually was in Atlanta in early March. And people started being like, oh, is it going to be safe to travel? Is it okay to go to Georgia? I was like, we don't even have any cases here. This is like not a big deal, And then like right before the conference, it was like, oh, well, there's cases in Georgia now, and it was like, so that conference ended up being like right before everything shut down. I got together with people from all over the country and some from international here in Atlanta. And then like a week later, my daughter's school was canceled. Like that March 14th or whatever that day was, like mid-March.
Wow.
And that was kind of where I was like, oh, like I remember that week it kind of going from like, oh, this is not good. And then it was like, oh, it's getting bad. Like they're probably going to start canceling things and closing stuff. And I was like, at first I was like, well, I bet they'll just cancel school just until spring break and they kind of figure everything out and then we'll come back after spring break.
Yeah.
Because we have an April spring break. So I was like, that'll, we'll be out for a couple of weeks and then we'll go back in April. And then I was like, oh no, we're not going back in April. And that's when I was like, I think May is when I like started using Twitter, and I was like, maybe people on Twitter are talking about COVID. So, like I had really never spent any time on Twitter. I didn't know. I don't even really know what kind of brought me there, but I remember
how it was. It was a scary time because we just didn't know much about the virus. All you had was these China doing all these kind of things, and it was super scary. And we didn't understand. Like I didn't know how dangerous it was to go into hospitals, see patients who had COVID. I have a daughter that is on has a liver transplant, so she's on immunosuppressives. And so yeah, I mean, I put her in a room for like a week and like quarantine her because I just didn't know anything. And then I wrote, an email to the school saying, hey, I don't know if this is the best idea to like
Yeah.
keep schools open. But just like you, I thought, once you kind of had a sense, Philadelphia had one of the earlier outbreaks because we were closer to New York.
Mhm.
And at some point, I was like, well, I mean, obviously, I left my daughter out of the room partly because there's this network in the Oregon transplant community, and there weren't a ton of kids. It's kind of this local knowledge thing. There weren't a ton of kids in the Oregon transplant community that were necessarily like in hospitals. The children's hospitals weren't filling up, and so
Right.
yeah. So very quickly I pivoted from that to like because I know your interest for this came with the fact that the schools are shut down and like when are we opening back up again? And I think it was the same thing for a lot of us. It's like when are we opening back up again? And
Yeah.
why do we like
My
one thing
daughter,
okay.
I have a teenager. She's in middle school at the time. She was
Yeah.
in sixth grade, and so yeah, I mean that was definitely my thing. I was like, I wanted to know, like, was she going to be okay? And like, I saw some of the early report stuff out of like Diamond Princess, and I was like, oh, okay, it doesn't seem to impact kids too much. Like, okay, I can breathe a sigh of relief, even if I'm a little nervous about myself. I don't have to worry really about my daughter.
Right.
And then at one point, I have a relative who's a pediatrician. And so I had messaged with her about something. And I said, so how many kids have you seen with COVID?
Yeah.
And she's not in a big city or whatever. And she was like, oh, none. And I was like, oh. I was like,
Yeah.
okay, that's refreshing or whatever. I was like, okay, that, I'm a little more relaxed now even. And
Right.
so, but yeah, so to me, I was like, well, everybody's going to go back to school in August and September. And then when it was like, oh, some people are talking about not going back, I was like, well, once we open in Georgia in August, we'll show everybody that it's like no big deal. And then people can open in September or October or whatever. Yeah. And then that didn't happen. And I mean, I've seen some other people say that of like people that were in, southern states that did open. They were like, well, we figured once we opened and everybody saw that it was fine. But instead they saw cases and panicked more.
Right.
And it just kind of spiraled from there.
Right. Yeah. It was just crazy. And it's like when you realize like, oh my God, the people that are in charge are not really in sync with reality. And they're looking at these dashboards constantly. So of course, since they're looking at these dashboards to kind of keep things closed forever and basically change our entire existence as we knew it, that's when, you started looking at, while I was sending angry tweets, you of course were doing something useful and and got on and started monitoring the Georgia data.
Yeah,
and,
I mean, I shared like the first thing really before I don't know if I was on Twitter yet even by then or not, but I had seen an article in Wired by David Zweig or however you pronounce that, about schools reopening in Europe. And I was like, oh, see? And I like shared it on Facebook. I thought everybody would be so excited to see this news. Yeah. I'm like, schools are reopening in Europe and all is good. And like instantly someone replied and were like, with the WebMD article about this dangerous new heart condition in kids or whatever. And it was like the MIS-C or whatever. And I was like, oh. It's like, so it's really rare. And it's like, I'm like Europe and they're opening schools. And they're like, we're not taking chances with kids. And I was like, oh, okay, this is going to be an uphill battle.
Crazy. So one of the things that was used to really, put the kibosh on certainly schools and kids and what we've done to kids has been data on deaths, COVID deaths, pediatric COVID deaths, right? Is that and you were and you've been on this since the very beginning. So you started looking at the Georgia data because you, of course, wanted to buttress your claims to, your theory that, hey, I think we've never done this before. This never in a million years, never since in human existence have we acted like this. And now we're going to go down this path. You're like, I don't know about that. And you started looking at the data to say, well, what exactly does support them on their claims? So what did you find did you find any discrepancies when you were looking at the initial Georgia data early on?
Yeah. So, I mean, initially a lot of it was where I'd see something in the Georgia data, but then I'd see it being reported like wildly different in the news, or reported in the news in a way that like people didn't, they'd use a
Yeah.
daily number instead of a 7-day average, or, and so they'd be like, when some random day would have a big number, and it was like, that's what would get reported. And I was like, what people are hearing is not really what the data says. And then like, so I just, started paying a lot more attention to those numbers, and watching for things like that. And that's when I started seeing like more issues crop up about, well, why did this news article cite this number? I'm like, that's not the number. So I dig in. I'm like, kind of like an auditor or whatever would with financials. So, like, why isn't the checkbook balancing kind of thing? Where did that number come from? And so I'd go dig in. I'm like, oh, well, they found it from this weird source, or they added this and that, or they looked at, the wrong thing. And it was, let's see, I guess it was May, of 2021 that the data tracker like became, it was like everybody's citing this number for pediatric deaths that came from the data tracker. And I was like, what is this data tracker? I was like, where is this coming from? And why don't the numbers line up? And so that, I started kind of like hounding the CDC about it. And nothing happened for a long time. The numbers would adjust up or down sometimes. And another Twitter user kind of helped me in contacting them as well. And we did get like one adjustment down then, and then like, but it just kind of kept fluctuating, and it would grow again out of proportion to other numbers CDC had for pediatric deaths. And it's still a problem. It's still overreported there. CDC has admitted many times in writing that that's not the most accurate source for numbers. And they make these wild adjustments to it all the time, which kind of confirms, it's not a very accurate source. And yet that's what is still often cited in news articles and on Twitter by various, what you would think would be experts that, were trusted people, including the CDC themselves, or Fauci. I mean, have thrown out some of these numbers, and I'm like, that came from the data tracker, or that's just a number they made up out of their head because it's not, it's this nice round number, 1,500, or this. And you look and you're like, these numbers don't line up with what we're actually reporting.
Well, so one of the things
CDC, and so people are like, oh, you think the CDC is lying? I'm like, no, the CDC has like other numbers that they say are more accurate. Like, I don't think they're lying. I think they're just citing, for whatever reason, numbers that they know aren't the accurate ones.
They're cherry picking. They're cherry picking. I mean, so one of the things that you hit hard over, one of the things you kind of discovered in terms of an obvious discrepancy is this fixation with single day numbers, right?
Yes.
And so, one of the people that you call out specifically is the BNO News. Who is BNO News?
Yeah.
What are they? Were they British?
So that's like been a recent thing because Megan Rainey, I guess she had cited where she was like, we have 616 people dying of COVID per day. And I was like, no, we don't. I was like, even the reported numbers, which are too high, are like in the 400s. It's like, where did she get this very specific number? Right. And so when I dug into it, I was like, oh, it's from a tweet from this random group that, BNO News, whoever that is. And she cited that number as if it was like a daily ongoing average. Jerome Adams also like quote tweeted that same tweet from BNO. It was like, look, 616 deaths in one day. And I'm like, hey, this isn't happening in one day. Like these death reports, a lot of states like Georgia only reports once a week now. So we report Wednesday afternoon. So I assume those numbers are probably getting rolled into BNO's like Thursday report. So people are like, but they see, only 20 something states reported. And I'm like, yeah, but one of those was Georgia, and we reported 7 days at a time. So that really counts as like 7 states. And we're one of the bigger states even. So I'm like, yes, a couple days a week, the numbers are much bigger than all the other days, but they don't point out, nobody, when they see 0, they're like, oh, but that's because not many states reported. And I'm like, but they didn't report then, they reported other days. That's why you look at the average. And now the CDC is switching to these weekly reports they said they're going to do, which I'm like, will make, I think, things much smoother, because that takes care of the fact that, nobody's reporting on Sundays anymore. They just aren't. But that means Mondays are bigger, or, Wednesdays or whenever it is that that state, reports. Because what happens in a reported day is totally different than what's happening in real life. I mean, these death reports are coming in a month sometimes or more after the actual death. So even if we were getting exact daily reports, they still wouldn't be accurate to what's actually happened the day before, because it's, it takes time.
Right.
So so numbers just are not, like, people have this idea that, if all the states just reported every day, the numbers would be perfect and everything would be exactly what's happening on a day-to-day basis. And they just aren't.
Right. So that's one big thing that you pointed out is that, this hitting people over the head with, oh my God, there's 500 kids dying a day, when actually, no, that's not 500 kids dying a day. It's like you're reporting 7, who knows how many days worth of.
Well, that 616 was for all ages. So like sometimes I kind of, I go back and forth sometimes whether I'm talking just about kids or everyone, but I mean, that's all ages, and and it's not anywhere near that number. We haven't had, if you go by underlying cause of death, we haven't had even 400 people a day dying underlying cause of death in more than 6 months in the US. But yet, vouching everybody, I mean, they cite that number all the time. Oh, we have 400 people dying a day of COVID.
Right.
But their own CDC, I mean, numbers on what actually caused someone's death is much lower than that.
Right. So death attribution, I mean, is a very complicated, very, very complicated thing, of course. And we're not even getting to the point of, well, with COVID deaths from COVID deaths. You're upstream of that. You're saying, like, wait a second, they're not even presenting, the deaths that are being listed appropriately, right?
Yeah, I mean, there's so many ways to die, and I mean, I've been called so many horrible names for trying to point some of these things out and look into this. But I'm like, I don't really get it. I don't get the obsession with overstating these deaths, of trying to convince everybody that the CDC is somehow missing. I mean, there's a lot of people who are just still convinced that we're missing tons and tons of COVID deaths. And I'm like, well, if we are, then no one's dying of anything else, because like, I don't get it. Like, I don't understand the excitement some people have to just make these numbers bigger than they already are.
Well, there's a reason, right? And the reason is that you need to compel certain actions, right? Without COVID in kids being an emergency, right? How the heck do you how do you mandate or how do you encourage or mandate vaccines? How do you kind of force all these different things that, school closures, HEPA filters before schools can open? Like, you need to have a problem. You need to have a crisis.
Right. And that's one of the things I found at one point on Twitter that I like retweeted and got a lot of attention to, was, a person in New York City, like part of the health department or whatever, that she said, they had put out a press release about the number of pediatric hospitalizations. And then they were like, well, we put that out. It wasn't because it was actually a problem, but we needed to motivate parents to vaccinate their kids. And I mean, she said that like on a panel in a video. And I was like, I mean, you're being played. Like, when someone gets up there and says, we told you a scary number just so that you would go do what we wanted. I mean, I'm not saying no one has had COVID, no one gets sick, it's never bad. Like, people seem to think that sometimes, like, oh, if you're minimizing or whatever, but when someone actually sits there and tells you, I told you scary things just so that you would do what I said, not because it's actually a problem, like, that to me was like, wow, they just said it right out loud. I mean, it's been obvious, some of the things that have come out of the CDC. And I'm like, you see it now. It's just so clear. Like, yes, you want X outcome, and so you tell us what we need, what.
So one of the things that you took the CDC to task on was this idea that COVID is a leading cause of death in children.
That was the big one.
Right. So can you walk us through a little bit?
Yeah.
What do you, I don't know if you have the details there, but
so that was that was a crazy one, because I somebody had sent me a couple of different ways. Like, I think people were kind of seeing it, and I don't remember what I was doing that day, but I was like getting DMs from people, and I saw a tweet, and, kind of like things started kind of falling into place of like, there was a screenshot of a slide from the ACIP meeting that listed the ranking or whatever for these causes of death for kids under 20, I think, and it was how it was broken down. And it was in the top 5. And like I said, some of these numbers I just know off the top of my head. I was like, that's not correct. But I was like, I don't know where they're getting that. So I'd have to dig in. I'm like, I got to get to my computer. And then somebody else had sent me, I think, a preprint article. And it turned out that the preprint was where the data from the slide came from. And so when I started reading the preprint, I was like, wait, these numbers look familiar. And I looked at the slide and I was like, yeah, that's where they came from, is this random preprint that just came out from people who are kind of some noted COVID hysterics.
Yeah, so Dr. Seth Flaxman and Dr. Deepthi Gurdasani, they're both from the UK, academics from the UK.
Yeah, everybody on the whole preprint was from the UK. I mean, and for whatever reason, they thought they would do a study, which isn't even a study. It was like a science report on how many COVID deaths or whatever there were in kids in the US. I'm like, I don't know why they chose the US when they're in the UK, and they clearly weren't that familiar with our data as far as how they pulled it, because when I looked into it, I was like, they were comparing multiple cause of death for COVID to underlying cause of death for other causes. So they were comparing, COVID deaths where the underlying cause of death was not listed as COVID, but the person also had COVID, to ones where, to causes of death based on only the underlying cause. So it's like, you can't compare the two, because the multiple cause of death numbers are definitely bigger. So I'm like, that's apples to oranges. And then on top of that, for whatever reason, they compared the entire COVID pandemic to just 2019 deaths for the other causes. So it's like, not only are they comparing the multiple cause, which is higher than the underlying by a good bit, then they are comparing 26 months of data to 1 year of data. And I'm like, so obviously the 26 is the bigger number. Now, they did it 2 ways for even a stranger reason. Included in their rankings, COVID would be listed like twice. So it would be listed like 4th and 7th or whatever, where 4th was the cumulative and then 7th was the annualized. I was like, you would just never, ever do a ranking that way. But they did. And then on top of it, then CDC used that cumulative ranking. So they used the higher one. So it's like, not only did they use a preprint that is faulty because of this multiple cause of death issue, then they used the faultier version of the data from it by using the cumulative. So I'm like, it's partly on the preprint authors, it's partly on the CDC who, extracted the data from the preprint. So yeah, at first I was just annoyed with the slide. I didn't know the source of it. And I started kind of tweeting. I was like, these numbers are ridiculous. This isn't right. I'm looking into where they came from. And then I was like, I'm like, okay, it's for this preprint. Then I was like, this was used in the ACIP vaccine committee meeting. Like, that's who like the CDC presented this in such a high stakes, meeting. And so that's when I reached out and I emailed, this was like a Friday. So I emailed the Flaxman author or whatever on the preprint. And I was like, there's a problem with the data. And I emailed the CDC person. No one from the CDC ever basically writes back. So that went nowhere. But the Seth Flaxman wrote me back and he was like, well, I'm headed into the weekend. I'll look at this Monday. But obviously it started blowing up. So then I heard from him over the weekend later. And he was like, okay, I'm looking at this again. And he was like, so where can I get those numbers for the underlying cause? So I'm like having to send him links to Wonder and trying to like help explain where to even find the data that he wants to do his little report. And so they were like, okay, we'll update it. And then they did update it like weeks later, but they did post like it's going to be updated. And I was like, see, the CDC just used data that now even the preprint authors admit they had problems and they're redoing it. But then Walensky still cited the number again, like she put it in a White House briefing.
And just to
COVID
be
is the top
clear,
five,
just to be
leading cause
clear,
of death in kids.
yeah, just to be clear, the source of this data that the British academics are using, which the CDC is then presenting to the ACIP,
Yeah.
is actually the CDC Wonder database.
Yes. Yes.
So,
So, I mean,
the database that the CDC basically has its name on, which
right.
generates, which you can generate, which I have done, generate, based on codes of cause of death. That, instead of the CDC just looking at their own data, they use
let
a
some UK
preprint,
people do it.
which was faulty, and it's faulty for multiple reasons, right? The major reason is that they the underlying cause of death versus multiple causes of death, and they literally, I mean, it was like a falsely stated thing. I mean, what you want is, COVID is a sole cause of death, and they used COVID, where COVID was one of the things listed, correct? Right. So that's one. So that boosts the number. And the second big problem is that when you're comparing, like baseline levels, right? Like, how do you compare, deaths from whatever? They use
2 years to 1.
They use basically 26 months, more than 2 years, right? Right. They use 2 years and 2 months worth of COVID deaths, and put that in a ranking that had yearly deaths, right? Like deaths per year. So this is a ranking, just for the people that are listening. This is a ranking that has where is it? You recreated it. I'm looking for it right now. Sorry. For things like malignant neoplasm, accidents, intentional self-harm, assault, right? And the CDC ranking for where they ranked it for the less than 1 year group, the CDC ranking of COVID as COVID caused deaths for less than 1 year was number 4. When you did it, it got corrected to number 9. And it's the same thing. And all you did was just go to the CDC Wonder database, the source we're supposed to go to, and corrected for single cause of death. And hey, we shouldn't look at 26 months. We should look at last 12 months, basically, right? The same number of same time span.
Yeah. Yeah. Well, I'm trying to remember. I think I did the 26 months, and then I annualized it. So I, divided by 26 times 12 is what I think I did. Is how I, would have approached it or whatever. Cause I was, over the pandemic, how does it compare to 1 year?
Right. Because, you've passed algebra. I mean, right.
So, right. And that's what, Vinay Prasad, when he talked about this, he was like, this isn't groundbreaking stuff. I was like, no offense taken, I was like, this is pretty basic algebra, and
No, yeah, it's not meant. Yeah, it's not meant.
I was like, I'm not doing like these.
Yeah. No, right.
No.
It's not meant as anything against you. It's meant as just to be a.
Right. I was like, no, and that's why it was kind of so crazy that this was so obvious. I mean, like, really, the CDC was their own data. How did they not know where COVID ranked? Like, it's literally a query you can run in Wonder that says rank the causes of death. I mean, it's a very simple query. Yeah. And so they, like, I was like, well, we'll see when they update it, it should be like what mine is or whatever, essentially. And instead, when they updated it then, though, they went and looked at only April of 2021 to March of 2022, which was the worst 12 months of the pandemic. So, because I'm sure they wanted to make it look as bad as possible. So instead of using the date, the time period that they originally used in their original version, their pre-pan, which was the COVID pandemic versus the 2019 deaths, they went and just said, well, how does COVID rank as a cause of death, in that worst 12 months of COVID compared to all the other things that happened in those same 12 months? Like influenza was really low during COVID. So that fell down the ranking. And I was like, I don't know. I'm like, I'm a psychology and education major in college. I mean, I did some study things, in college, but I'm not a research scientist. But I was like, to me, I'm not really sure it's okay to just go change the dates on your study, like when the results didn't come out how you wanted them to be.
Yeah. And then compare. And that's the other thing they did, as I recall.
That doesn't really seem quite right, but that is what they came out and did. But
and then compare, and then
wasn't in the top 5 in most of the age groups. even when they did like literally jump through every hoop they could, I think, to make
Right.
it be as bad as possible. And the CDC still, like, it's up on their website on the ACIP decision, like matrix or whatever, for that vaccine for kids under 5. And I'm like, I get that that was part of what helped you make the decision, which is horrifying, but you should probably also like note there that this information turned out not to be accurate, because now it says in black and white on the CDC website, COVID is the, fourth leading cause of death or whatever in this age group. And links to a preprint that now doesn't say fourth leading cause of death. Like if you actually follow the footnote and go to the link, but like, to me, it seems like that should be updated. And they've then restated that. The chair of the ACIP in a recent, the September meeting, she also cited that again. She was like, well, we all know COVID is the top 5 leading cause of death for children. And I'm like, that's not accurate. Like, you were lied to by the CDC.
Yeah.
And now you're parroting that because no one ever told you, by the way, that wasn't true. We used a bad preprint and manipulated the data. And
they got all this, right. They got all this stuff wrong. The counter is that, well, how does it matter if it's number 4 or number 9? It's still bad. And so therefore we should do X, Y, and Z. What is your...
Well, I mean, a big thing is the ranking is, I mean, the top 2 or 3 are by far bigger than anything else. Like, I mean, accidents are just a huge cause of death for young kids. And I mean, parents aren't bubble wrapping their kids. Like, they let them, go up and down the stairs. They let them swim. They, let them ride in cars. They, like, if we really wanted to stop COVID mortality, like people keep, or, childhood mortality, like people keep telling me is, abhorrent if we don't stop all COVID deaths in children. Like, why aren't we trying to stop all drowning deaths in children? Like, we should for sure drain all the pools and close off all the lakes and, make laws that children, have to be supervised in the bathtub. Because, I mean, drowning is a huge cause of death in young people. I'm like, and, the same for cars. Like, why don't we have laws that kids must be in, 5-point harnesses, rear facing until they're 18? I mean, that would cut down on pediatric, vehicular deaths substantially, way more than we could ever reduce COVID deaths. But people don't want to do that. They don't want to have their 12-year-old sitting rear facing in a 5-point harness in their car and drive 10 miles an hour, while you're at it. That's just not how life is arranged. Like, so that's, to me, like, always been the thing of like, and I mean, somebody was just kind of harassing me today about masking and I was like, I just don't want to wear an N95 everywhere I go, and it's the same thing with, like, I just don't want life to be like that. I'm willing to accept some level of risk, and most people are willing to accept some level of risk to live a normal life, to let our kids go to school and to birthday parties and to swim and, go to camp, and all these things that were taken away. I mean, my daughter had one of those pandemic birthday parties where we had to be on Zoom and, she blew out her candles in front of a monitor like this. Because it was in April. It was like right after everything, shut down.
How does it feel?
The drive-by birthday parties, where you drive and wave out the window and honk your horns and stuff. Like,
does it feel like you won? Meaning, life is. I mean, we've been watching the SEC since all of 2021, and so
yeah. So I mean, that's one of the things. Like, for me, like, everything went back to normal for us a long time ago. Like, really, a lot of this is now that I've made all these connections with people where there are people in New York City where the parents still aren't allowed in the building to see their kids, play basketball or whatever, because the parent's not vaccinated, or they don't have parent-teacher conferences in person anymore at all. Like, you can't go in the school if you want to talk to the teacher. And I'm like, our school was completely back to normal last year. Mask optional, like, a year plus ago. I was like, this year, my daughter says literally no one, wears a mask, like not a single mask in her school at all. And I've been around to some other area schools, and it's even very different within Atlanta. Like we're in a suburb, but not that far from the city. Masking, not very common at all. But you go just a little bit further, I mean, 20 minutes from here, and, there are classrooms of, preschoolers where half the class is masked up still. Cloth masks falling below their nose. And
what's the difference? Like, why are they doing that in your suburb?
I mean, they're not requiring it, but it's just, culturally and politically, and I mean, I don't know what all is going into it still. Like, it's weird to me. I mean, even my husband works not very far from here, like, again, 20 minutes, maybe a little more. And yeah, his office, the place they go to lunch, like his office is pretty normal, but I mean, they go to lunch across the street, and they all pull out their masks or whatever to walk into the grocery store or something if they're going to pick up a to-go salad or something. And
do you think it's politics that's driving it? I mean, do you think?
I mean, a lot of it is that just it's like the political, social, everything. I mean, it's people in town Atlanta are just that much different than people 20 minutes away outside of town, and people in New York City are just that much different than people in Atlanta. Even, I mean, there was somebody posted a picture recently of in Decatur, Georgia, which is like in near city of Atlanta or whatever, in town, right where all the CDC and Emory University is, that had like a Halloween decoration that was like, "Oh, I did my own research," written on a headstone or whatever in 2022.
Well, Michelle,
Kelly, you're anti-germaphobes. Don't the germaphobes have a right to live with masks and to be surrounded by people with masks?
Yeah, I mean, a lot of them want to start like their own colonies or whatever, which I guess they can do. But yeah, I mean, we've just moved on in this country. I just don't see it. We never did that for other diseases.
I know, but we used to wear hats, and gentlemen used to wear hats, and now we don't wear hats anymore. I mean, things change. So, but let me ask you something, Kelly. Before, like in March of 20 or February of 2020, what was your impression of you're in the CDC's backyard, right? They're headquartered in Atlanta. What was your impression of the CDC? If somebody came up to you and said, "I work for the CDC. I'm a director at the CDC." Yeah. At a party. What was your impression?
I always thought, I mean, I never really had any ill feelings towards the CDC. I don't know. I actually went to Emory. I mean, I lived in their backyard for 4 years. And yeah, I mean, I know people that have worked at the CDC. I don't, I don't know. It's weird.
Now, if somebody comes today and says, "I work at the CDC. Hello, my name is John Smith."
Oh, then I hope that they don't go on Twitter and don't know who I am. That's happened a couple times. I'm like, "Oh, interesting," and then we just change the subject because I'm like, "Oh, please, I don't want it to be awkward."
But so, I mean, does it cross your mind to wonder why? I mean, these are supposedly well trained. The top, the cream of the crop from epidemiology and public health. Why?
I mean, I think part of it is just someone else that I follow on Twitter, Newman Nahas. He had tweeted at one point, and I thought it was a great kind of comparison. He's tweeted a lot about this, and I have as well. Like that. So much of this is like a value judgment that's separate from the science. Like you can tell someone the science, but doesn't necessarily mean they can tell you how to judge and value things in your own life. Like to me, I value not wearing a mask. Like I would just really rather not wear a mask. I'd rather take some extra risk. I'd rather, not drive 10 miles an hour on the road. I'd rather, get to places in a reasonable amount of time. But he said like the trolley dilemma or whatever, he's like, you don't ask a train engineer how to solve that. Like it's not a train science problem. There's a moral, aspect to it and a value judgment that that science can't
Right.
answer for us.
So
Yeah,
who,
I mean,
right, but then how would you, I mean, we live in society, there are, 40%, 30%, I don't know how many germaphobes who want masks. And then there are anti-germaphobes who hate germaphobes and who don't want to wear masks.
yeah, I mean,
What is the CDC supposed to do?
I think to me, like for like part of it is we still haven't really shown so like that they're doing all that much good unless you're wearing, like, again, a well-fitted, respirator. But then if you are wearing a well-fitted respirator, I mean, doctors, as you put on your, respirators and go into actual sick patients who might be coughing in your face or whatever. So then you are protecting yourself. But yeah, I mean, I think the idea that we can fundamentally kind of reorder society around, like some people's fears, is just, when we have all these other things now. I mean, we have vaccines, we have like, this isn't, I mean, some people would argue that it still is, like that this is not like a civilization ending event, that we
Right.
should be able to kind of go on with our lives.
But
So
if you or people you look up to were in charge at the CDC, how would you look at what data would trigger? At what level would you say, okay, now we need to lock down. Now this is, COVID is bad enough that we should lock down, or this next epidemic is bad enough that we should lock down. And some people will disagree with you or might disagree with you. They say, okay, if death is 1 in 5, that's not enough. We still want to live freely. Call us back if it's the number one cause of death. So, or if I look out the window and I see bodies,
right, and I think that's part of it. Is, to me, I think it would have to be back to where it would be bad enough that people would be voluntarily doing. I mean, and I think back at early on in COVID, I think that was happening a lot of times, because like in Georgia, I mean, we opened very early. I mean, Governor Kemp was criticized widely for reopening in April when he did. But I mean, things are still very, like, all the precautions from then were precautions because people saw what was happening and people knew people that were sick.
Mm-hmm.
And so a lot of people were voluntarily not going. I mean, I didn't go out to restaurants for a while. I was nervous. Like,
right.
I am not one of these people that say, oh, I knew from the beginning and I never stopped going to restaurants and I never stopped doing this. I was very nervous going back to restaurants, and I do know part of it is my own anxiety. But
then why do we need a CDC if we're going to just follow what people voluntarily want to?
Yeah, I mean, and I think that's where, if we could look to the CDC to give us accurate data, that then people can make their own decisions, and people could get guidance over what they suggest we do, or some steps to take. Like, again, I mean, that's what we do for other things. We say, oh, well, drowning is dangerous. Here are ways to protect yourself. Wear a life jacket, get training or whatever. Like, get your kids classes, learn CPR. Learn the signs of drowning. We don't mandate all these things. We don't lock down the pools, and we don't have age limits for who's allowed to swim in the country and who isn't, or who's an essential swimmer and who isn't.
Right. We mandate measles vaccines.
We do.
Should we make that voluntary?
A lot of these things, I mean, and it's interesting to me because I am a person who, I don't know, I always looked into things as far as with the vaccine schedule and stuff. I wasn't just like, oh, if you say we need it kind of thing. But my daughter is vaccinated. I don't have any religious exemptions or whatever for her. There are some things I delayed. There are some things that, that I didn't do that weren't required. But yeah, I I kind of was like fairly go along with the flow kind of thing, but I also kind of did my own, reading to understand. But yeah, now it is frustrating because so much of that trust that you did kind of trust that the CDC does generally, have the data and have your back and is giving you the right stuff. Now I see them, post stuff that just I know isn't right and I know is purposely misleading. Like they tweeted in August, childhood hospitalizations for COVID are going up. Well, they posted a graph that already showed them going down, and then the graph even was delayed. So I'm like, they've been going down for 3 weeks. Like, why would you post? And then Georgia Department of Health, for whatever reason, months later decided to retweet not retweet, but like freshly tweet the exact same graph and say they're going up. And I'm like, they definitely are going up now. They've been going down for months. Like when you see public health just tell you things that are,
right,
just factually wrong, now you wonder, have I been, do we have an organization we can trust? Like,
right.
I don't know that I don't need an organization like the CDC if I can't trust that the numbers that they're telling me and the data they're telling me is accurate. I want there to be something like that I can trust. I would like that.
Right. But have you gone back to look to see if the measles vaccine mandates are justified? I
haven't. I mean, when my daughter isn't scheduled for any more things right now, and I haven't gone, but I do. I don't want there to be measles. Like, I don't want there to be a polio outbreak.
It was completely normal. We lived as we wanted to before measles. It was fine. I don't want my life changed just because some germaphobe like you is afraid of measles.
Well, I do get that. I really do. But yeah, it's just really interesting to me, I guess, how we've kind of like normalized this fear of, so many people now have had COVID, especially in the past year. So they've had Omicron and they're like, I had some sniffles, I had a cough, I was tired one weekend or whatever. And life went on.
Right. But you're not willing to concede that the comfort that you have with the measles vaccines and the mandates could possibly have been manufactured in the same way that this fear of COVID has been manufactured?
Yeah, well, I hope not.
Michelle,
with the bathwater kind of, but at the same time, it is very unsettling. And it's not even just with the CDC or not even just with health issues. Like, it's just unsettling kind of in your whole worldview when you're like, when I read something in the paper, or I see something on the news, and now I know the journalist just randomly sometimes puts stuff out that isn't even remotely accurate. It's unsettling to just know that basically you do kind of have to do your own research. You have to double check. You see some number, you see some fact or some new claim. Oh, this thing is bad for you. This thing is good for you. This thing is going to kill us all, whatever. Like, you have to go, is that right? Or are they just lying to me? Are they just saying that? Are they just idiots? Like, are they trying to manipulate me? Are they just wrong? Like, it's not good for me. I feel like that we don't now know that we can trust information from, and some people are like, oh, you're an idiot if you ever thought you could trust the news or the government or whatever. Maybe I was a little naive that I felt like, oh, if the CDC put some information out, or I read an article about something that it was based in facts. And so, yeah, after spending 2 years now reading stuff and going, well, that's just not a fact. It's not good. It's not good for America. It's just not good for me. I would like to know that if I read an article or the government tells me something, that it is remotely true.
Right.
And it's unfortunately when I can get on Google and in 5 minutes say, I can prove you wrong, it's a little frustrating. And it does kind of make you wonder, like, what things have I accepted as truth about diseases or anything else my whole life that now maybe is just completely wrong.
Indeed. And maybe that's the silver lining of this.
I don't know if that's a good thing. Like, it's a little depressing to know,
Michelle,
like,
yeah.
Michelle, it's pretty clear that, or you would agree that that the quality of the scope of public health has expanded a significant amount, even in the time that in the time certainly I've been alive, and certainly, even longer in the time you've been alive.
Right.
So, I mean,
the extra
I think
yeah.
it's possible. It's certainly, I mean, you could it's not unreasonable to make the case that the CDC of 2020 is incompetent in a way that that the CDC in the 1950s was not, right? So, I mean, and of course, as we move through life, like, and you take out some of the things that are really bad, you're left trying to chase after smaller and smaller benefits, right? But yet public health still needs to be powerful. So public health still needs to make it out like this is smallpox, or this is, whatever. So you can see, I mean, it's not, I know what you're saying, in that it's entirely possible that we've been lied to all along about everything. And that the only reason that this is coming to light now is because now, with the internet and information and where it is, you can have somebody who's, I mean, a highly educated person, of course, Kelly, but, not, say, a public health expert, can within 5 minutes check the CDC Wonder database and do all these things that people in the 1950s could not. But again, smallpox was rampant at the time. Polio is a pretty severe illness, and you have to do some work. What's that?
How much do you know about polio?
I don't, other than how devastating it was and the fact that it disappeared. I mean, again, I'm willing to give you that it's possible that there are things that we don't know about it, in the sense that, what exactly was it that allowed polio to kind of pass? Right. I don't know the exact details of it, but
we should have a show on that, because I think I've uncovered some interesting things. There's serious scholarship to say that FDR didn't have polio.
Oh, really? I don't know. Yeah. Who knows?
And yeah, do you know how many viruses can cause paralysis?
Kelly, our next guest is actually Alex Jones. So we're hoping not to be sued for $1 billion after we're done with it.
Yeah, anyway. I don't know. Like, to me, that's been probably the most unsettling part about this. Of just that it's just so easy for me to just look at an article or a statement from the CDC and just be like, I mean, that's just wrong. That I sometimes I have to do a little research. Sometimes I literally can just read it and say, well, I mean, that's not an accurate number. Yeah. And so, yeah, it's a little frustrating thinking, what other things have I read, or what other studies have been, just grossly misrepresented that I, read and just accepted as they were.
Yeah.
No, there's been a number of corrections I've made. I mean, I've got all the emails for different newspapers corrections, and like, oh, okay, yep, time to email the Washington Post again, time to email the New York Times. Like,
right.
Yeah.
I don't have to do that.
Just not to dwell too much on it. I mean, we've taken a lot of your time, but on the question of cause of death, COVID cause of death and whatnot, is it the underlying cause of death, or is it, a bystander? And that's very hard to parse. I mean, it's almost impossible to parse. And if somebody seems to have, they have pre-existing cancer and they get admitted to the hospital with metastatic disease and whatnot, and they happen to have COVID and they die, how can you say that COVID did or did not contribute to death?
Right.
You can't.
Right. It's very complicated. And I've definitely, I can see both sides, both directions where you could argue it on so many cases. But some of the ones, and specifically where I've looked at kids, because again, that's kind of been my focus, is there's, and I don't know some of these individual cases, how they end up getting listed on the actual death certificate. But like, we had COVID cases in Georgia where, it was a car accident, a teenager, didn't know they had COVID. So, asymptomatic COVID in a teenager, car crash, massive injuries. And, it was definitely included in like the Georgia count. I don't know if it was listed as underlying or multiple cause or whatever, but they said, well, COVID contributed to his death. because but I'm like, well, his lungs were crushed or whatever by the steering wheel. He had broken bones like everywhere. I feel like putting that as COVID is the underlying cause of death, if they did, which I hope they didn't, would be kind of clearly not the case. Like clearly, if you want to make the argument it contributed, but I think even sometimes
because there was a delay because all the healthcare personnel had to gown up and put their N95 masks and whatnot, and it took a little bit longer to get and start doing CPR and
and I mean, we had another case where a boy, he had a febrile seizure in the bathtub and then drowned. And they took him to the hospital. Oh, well, it's COVID. So I'm like, would we count that as an underlying drowning death normally? Would we count like if that was caused by strep or whatever caused the fever? Would we have called that a strep death? I don't know. If it was the flu, would we have caused that a flu death? I just think that partly we're counting COVID in a way, like whenever people ask me like COVID versus flu or whatever, like which is worse for kids? And I'm like, we just don't have the numbers the same way. Like you just cannot compare apples to apples. Like you can compare underlying cause of death to underlying cause of death, but we never tested people for the flu like we tested them for COVID.
Sure.
You can compare multiple cause of death to multiple cause of death, but again, still we test differently for COVID versus flu.
That's fair. That's fair. And to Anisha's point, I mean, when you have an organization, massive investment for the last 20 years, way before COVID, to prepare for the next pandemic and all that stuff, and you have sort of a huge industry of people who just were waiting for the moment to come out with their models, to come out with their policies, to come out with their changes and all that stuff. And it's almost unstoppable. And in fact, I mean, to this day, we haven't really stopped them. We've stopped them. I mean, the vaccines have come around, the numbers have come down for whatever reason. The two may be unrelated, and they've quieted down. But nobody was fired for making the wrong predictions, or nobody was fired for making. I mean, they're still in charge. It's the same people. They still have the same powers. They could do the same thing again. Perhaps not so easily, but
yeah. I mean, the White House just shared last week a model that showed if we don't get like a huge booster uptake, that COVID would peak in March, like the winter wave would peak the end of March. Right. And I was like, is there anybody who's been watching this that thinks we're going to start increasing now and increase all the way until March before it decreases? Like, I mean, the graph looked so unrealistic compared to everything. Like the last 2 years, we peaked almost the exact same day in January. Like I would be pretty surprised if we had a peak that wasn't in January. To see this idea of hospitalizations just going up and up and up until late March, I was like, how can they stand in front of that graph? And I mean, seriously try and treat that like that's an accurate representation of what we think it's going to do. I don't even really think they think that's what it's going to do. It's just like this other preprint. It was a model that somebody put out and they went, oh, well, that looks good. That'll help us make our case that we need everybody to take boosters. So let's just put it out there. And I think they probably in their back of their mind, they're like, this is the most absurd graph, but they're like, but it lets us show it's going to be super bad if people don't all go get their boosters right away. So like I shared that recently and someone was like, please save this and follow up in 6 months. And I was like, oh, I will. But I mean, I'm sure it's going to be like, yep, it was wrong. I mean, there was tons of models that were wrong about what would happen last winter. I mean, NPR put one out that said we were going to have no winter wave at all because we all had, recently taken boosters and we were all vaccinated. So there wasn't going to be a winter wave. And they had it going, like cases going down from fall all through winter. And yeah, a bunch of us thought, well, that doesn't really seem realistic, but okay, that would be great. And sure enough, we had the biggest wave ever with Omicron, almost right after they posted that model or whatever. So it's like the modeling especially has been really.
Should we abolish the CDC?
The thing is, there's no, they can never be wrong. Like I remember, it's so frustrating because I remember simply demonstrating or showing a graph, like zooming out on a graph to show that, that yes, there are pediatric deaths, but these pediatric deaths are 0.1% of all deaths, right? And literally, if you do that, that's misinformation because you're minimizing COVID. It's like I don't know. Is that not I don't understand how we're supposed to convey risk to patients or talk to patients when you have this group of people that this group of people that are so fixated. It's a religion to them, I think, in terms of what they believe and what they want. I don't understand why they want that or why they believe these things. But it is what it is. It's this. Yeah, I don't quite understand. It's and the managerial class of people that want to manage and micromanage all these things. It just seems so obvious now to everyone, not just other experts that they're full of hot air, but to the average person that they're full of hot air. So maybe that's like the silver lining that, these institutions that, my God, if they were left to themselves and people hadn't had this awakening moment with COVID to see how that they do need to be checked, that they can't just be taken at their word, maybe they would have done far worse, So, far worse in the next crisis that they, maybe manufactured or whatnot. Not to say COVID wasn't real and all that stuff, but my point is there's such a degree of hyperbole that they seem to traffic in order to kind of get compliance over certain things.
Yeah.
So,
and it's been strange because I would like to see, people that are 80 years old or whatever, getting the vaccine and getting boosted and, wearing a mask, maybe like a good mask if they had to be in an, unsafe environment or whatever, especially if they had, diseases or whatever that would put them even higher at risk or something like. And instead we are like obsessed with children that we're like, the new boosters came out and we're like, we're going to make sure colleges implement them. And I'm like, could we talk, like, could we replace the word colleges with nursing homes? Like, why are we so obsessed with getting colleges and employers to roll out these vaccines?
Yep. It's a worldview. It's a worldview.
And I just feel like that completely confuses the 80-year-olds who then are like, who don't realize, oh, it's super important that, like I'm extra at risk, like, because they're just like, oh, these people are crazy. They want everybody to get these boosters. Like,
right.
Whereas in other countries, they're saying the elderly need to get these boosters. And so I think the elderly go, oh man, I need to get this. I need protection. I'm at risk. I mean, it's a very different message that I would give to my, mother versus my daughter. And we're not getting that from the CDC. And it just doesn't make any sense. Like when
these people have
see it.
Way too much power and they should be abolished. Their institutions should be abolished.
I tweeted this morning an old clip. I remember watching it when Rand Paul, I must have been running in 1992 or 1996 or I don't know, one of those when Rand Paul was running. And
Ron, not Rand.
Ron Paul was running for president. And the guy who was on Fox News who gives people a hard time, whoever he was,
Chris
Wallace. Yeah. He starts with a clearly antagonistic question to Ron Paul saying, you have said that you want to end Medicare, end the Fed, end IRS. And as he's saying all that, I remember at the time thinking, this guy's a nut. Now I hear him saying it, I'm like, sounds good to me. So it's an interesting.
Ron Paul was right.
Ron Paul may have been right. Though I'd be okay with Kelly in charge. So
I just like
no, she's gonna impose her. She's a Misellian.
Well, like I don't know, like I don't have these decisions facing me anymore, really. But yeah, I'm like, it does make me think, like, what things?
Yeah, I think of all the people who got a ton of abuse for not wanting to have their kids vaccinated with measles and whatnot, thrown out, ostracized, and all that stuff. We didn't think much of it because, it didn't concern us. And we were sort of on board with having our lives, be disrupted in this way and versus
I like living in a world where we don't have to worry about things like measles and polio and stuff like that. And COVID. But
Well, they don't work. It doesn't work
But I
against
mean,
COVID.
so many of us have had COVID. We've seen kids that had COVID. I mean,
What about
even a lot
measles?
of
I mean, I had measles. I had measles. It tells you how
even
long
a
I.
lot of elderly people I know had COVID. People with serious comorbidities, and I mean, they had bad coughs for a while. Some of them
Michelle,
needed,
you have to local knowledge,
hospitalization.
Michelle. Local knowledge is telling you
Wait.
saying that
I mean,
COVID is
Kelly,
not as bad as
how do you
measles or
compare measles to
polio.
COVID, right? Huh?
Local
Um,
knowledge is saying COVID is not as bad as measles or polio for kids. So let the people do what they want.
How does local knowledge have any knowledge of measles?
Local, no.
Yeah, no. Kelly,
It's
she has
oral
personal.
oral history transmission. Anyway, we'll have to do a
Right.
separate episode on measles and COVID, measles and polio.
yes,
But
I know I don't know enough about measles and polio, to be honest. Other than that, I'm just glad that I don't have
well,
to worry
I mean,
about them.
you should look at the curve of measles mortality over the
Oh, boy.
20th century before the vaccines were it was
Michelle is
invented.
going to teach us next episode.
No, I mean it's very simple. Just look at the curve of measles mortality over the course of the 20th century, way before the vaccine were introduced, and you'll see something just going down, going straight down.
All right, we need a measles expert.
Yep, I am it.
Yes.
I am it.
Teach me about measles.
Kelly, thanks so much. It's
Yes,
been great
thank
having
you.
you.
Yeah, I hope this was helpful or interesting to people.
No, it's great. I mean, it really codifies some major missteps in terms of the institutions, and I think we should question the institutions and not blindly take what they have to say.
Yeah, I mean, it's definitely changed my perspective on a lot of that. It's been eye-opening.
Yeah. All right. Well, Kelly, see you on Twitter. Your Twitter handle
Yes.
is
Kelly KGA,
Kelly
Georgia.
KGA.
We'll have that on the show notes, and your website. your website is
covid-georgia.com.
great.
All right.
Thank you very much.
So I did not know it was going to go in the whole children direction, or I maybe had a different URL.
All right.
Bye.
Take care.
Okay, thank you.